the Virginia Department of Housing and Community Development. So first I want to start by saying Happy Black History Month. It is February. So I meant to say that in my team meeting yesterday and totally botched that. So just wanted to make sure I said it today. Happy Black History Month, everyone. And I want to take a moment just to introduce the team. I'm going to introduce everybody on the team. That way I won't miss anybody if they're here. You can see them hopefully in the chat. I don't know how your computer is set up. So I'm going to start by going through the different teams because that is the easiest way to do this for me. I'll start with Kendall's team, and she's managing all of the grants, and it's Kendall Clater. She's our program manager. And then on Kendall's team, we have Will Kerner. And all of the people I'm introducing are program administrators. So there's Will Kerner, Sarah Foote, Desiree Williams, Ray Obajero, and then we have Darl Wilburn, who works on our HOPWA projects. Then you move on to our homeless data integration program, and that is led by Andrea Ukrop, and Elena Sigsby works with Andrea. Then we have the Balanced Estate COC, and that's R. Mendoza, and R works closely with Brianna Green. And then we have Taylor Ryan, who's our Youth Homelessness Demonstration Project Coordinator. And then we also have Kike Oliver, who really is our jack of all trades, but she's a program administrator who works primarily on livable home tax credit and does all of our kind of documents and make sure they are in place. And then, of course, most of you know Rhonda Spear. She is the Director of First Impressions, our receptionist, but Rhonda is also closely affiliated with our team. She's not officially on our team anymore, but we've decided to hold on to her even though they thought they took her back. So that is our team. Did I miss anyone, team? Please. Thank you. Thank you. Thank you. I tried to do the org chart in my mind, and now that I have a visual of it, I should be good from here on out. So next slide, Kendall. So again, you are joining us for the first of two sessions about the homeless and special needs housing funding. And this is for the 2022-2024 funding. Next slide. All right. If you have any questions during the presentation, please put it in the chat. We're going to have time for Q&A at the end. What I will say is sometimes if we start answering chat questions during the presentation, we'll get so far off kilter that we rush through the end. So we want to give ample time for what we need to present and then answer questions at the end if possible, especially because some of your questions may be answered through the presentation. Next slide. All right, so you've probably heard this before if you've ever been on any of our calls, but DHCD's mission is to create is committed to creating safe, affordable, and prosperous communities to live, work, and do business in Virginia. And this is especially important for the people we serve because some of them don't have a place to live. They don't have a place to call home. So we can't create this safe, prosperous community without ensuring that all of the citizens in that community have somewhere to be. Next slide. And then when we talk specifically about our unit, we are here to make sure homelessness is rare, brief, and one time. So we do that by administering a continuum of state and federally funded homeless service programs so that we can address housing and stabilization services and also address people who are at risk of becoming homeless or experiencing homelessness in the Commonwealth. And at risk of is imminent risk. So we're talking immediately in the process of possibly becoming homeless. Next slide. So we have our state policy that is based on our state housing goals. And these goals have been in place for over a decade. And they're related to that need to make sure homelessness is rare, brief, and one time. But it means our goals are to reduce the length of time that someone is experiencing homelessness and meaning shorten it. And I want to make sure I point out in Virginia during the pandemic, our length of time homeless has increased by 143%. And that's not for a lack of work that you all are doing. That is because we are still in the middle of a pandemic. It's harder to find housing, and things are just, it's so many more factors at play. So some of the changes you're going to see today and hear about are our attempt to help you to reduce the length of time that somebody is experiencing homelessness. Also, we want to reduce the number of new cases. So reduce those people who are imminently homeless from ever entering the homeless services system, meaning we've done something to stop their episode or this episode of homelessness, and then to reduce the number of individuals returning to homelessness. So when somebody does get housed, we have all of the supports in place so that they don't ever fall back into homelessness. That's our goal. All right, now, was this my pass on? No, it is not my pass on yet. Or is it my pass on? Because I have a funny joke for Will. Is it Will? No? Not yet.
Yes.
It is. I thought it was. So where there's a will, there's a way. And I'm going to go ahead and pass this on. I feel like I missed my mark because I didn't see anybody laugh except the team. Where there's a will, there's a way. And so, Will, I pass it on to you to take over. Thank you.
Thank you, Nichelle, and I appreciate that joke, even though I've heard it countless times. Always a classic. Okay, so just quickly getting into an overview of the programs that the HSNH team administers. We have three main grant programs. The first is our Virginia Homeless Solutions program, referred to as VHSP, and that's the 2-year program that you all have been, applying for and utilizing for quite a long time. With that, we have our housing opportunities for persons with AIDS or HIV, also known as HOPWA. And then our Housing Trust Fund Homeless Reduction Grant. Since 2020, HSNH has been the administrator of our COVID Homeless Emergency Response Program, affectionately referred to as CHIRP. And CHIRP has 4 sub-programs within it. So that those first waves of CHIRP funding are the CHIRP program and the CHIRP HMIS program. Those are made up of ESG CV funds, and those have a program end date of September 30th of 2022, so this year. After that, we created our CHIRP NCS program, which was made up of Virginia Housing Trust Fund dollars, and that program ended the end of December last year, so December 31st, 2021. And then finally, we have our CHIRP CDBG program, which is made up of CDBG CV funding and has a program end date of March 31st of this year. And real quick, I just wanted to say that those end dates on the slide is what we are expecting the programs to go to. So we don't anticipate any changes in those program end dates. Next slide. So here's a breakdown of the funding that HSNH is currently administering. Under VHSP, we have $15,075,392. Under HOPWA, we have $1,375,014. And I'm not sure if you all can see the asterisks on the presentation, but it mentions that actual funding levels have not been determined as of this presentation and could vary significantly for these estimated amounts. And then lastly, we have our Housing Trust Fund Homeless Reduction Grant, which is a total of $8.8 million. And I wanted to mention that about $500,000 of that $8.8 million is administered by the Affordable and Special Needs Housing Program for pre-development projects. So that's kind of an overview of what we're currently administering. Okay, getting into the HSNH application cycles. VHSP funding will be administered on a 2-year funding cycle. So year 1 is going to run from July 1st of 2022 this year through June 30th of 2023 next year. The VHSP application proposed budget and VHSP year 1 requests, which are required attachments, is for this first year of funding in this new cycle. For year 2, that will run from July 1st, 2023 through June of 2024. And grant agreements will be renewed based on performance, compliance, and available funds. I wanted to also make a note that you can also see on the slides that that we have a minimum contract amount of $25,000 per grantee. Next slide. All right, getting into our HSNH guidelines. The revised HNS guidelines were provided in the email regarding the application. So we're going to go over the grantee requirements, the emergency response system, as well as the specific dates for VHSP and HOPWA grants, as well as the portions of Virginia Housing Trust Fund to be awarded within this application cycle as a bonus. I believe Sarah is going to go over the VHSP and HOPWA section, and Kendall will be going over the Housing Trust Fund portion. Okay, just some quick changes to mention off the top to our HSNH grantee requirements. And these requirements are outlined in the updated guidelines. The only two changes to overall HSNH grantee requirements are to the grievance and termination policy requirements and the requirement that all HSNH funded project activities adhere to the VRLTA. And a link to that can be found within the guidelines. For the grievance and termination policy, HSNH is now requiring a 2-level grievance process. So the first step of that being held at the grantee organization level, and the second level should the client not agree with the decision of that first process being held at the COC LPG level. At the initial level of the grievance process, the client or household's grievance may be heard by a person other than the person or a subordinate of that person who made or approved the termination decision. Then, should the client or household disagree with that decision by the initial review, a second level for appeal must be available at the COC or LPG level. We understand that COCs and LPGs already, that many already have this 2-level process in place, but that others will need time to establish this kind of process. So HSNH is going to require that the 2-level process be developed and formally adopted before the close of the 2022-2023 program year. Okay, getting into the emergency crisis response system. So overall, an effective crisis response system aligns a community, its programs and services around one common goal to make homelessness rare, brief, and one-time. The goals of an effective crisis response system are to identify those people experiencing homelessness, prevent homelessness whenever possible, and connect people with housing quickly and provide services when needed. And just getting into a breakdown of the different components of the crisis response system, all those are achieved through outreach to connect people that are at risk of experiencing homelessness to coordinated entry, emergency services and shelter, coordinated entry to quickly identify, assess, refer, and connect people to in crisis to housing assistance and services, targeted prevention to help reduce the size of a community's homeless population, and then finally, emergency shelter and interim housing and permanent housing. Okay, and just to quickly touch on the role of the COC and the LPG. The role of COCs and LPGs is to promote a community-wide goal of ending homelessness, provide funding for efforts to rehouse those who are homeless, promote access to mainstream programs, optimize housing stabilization, and the responsibilities of the COC and LPGs include to provide governance and structure to the COC or LPG, providing system coordination and planning. So that should include coordinating outreach and engagement, entry and assessment, shelter, permanent housing, supportive services, and homeless prevention strategies. COCs and LPGs are also responsible for designating and operating the HMIS for their area. And finally, COCs and LPGs are responsible for designating a coordinated entry system to assess households who are experiencing homelessness and best connect them to housing and services they need to return to and stabilize in permanent housing. And that is all I have for you. So I will pass it over to Sarah. I do not have a witty joke to go along with it, but check in tomorrow and I might.
Thanks, Will. Good plug for anybody who wants to return and have another webinar with us of the same exact material plus possibly a joke. I'm Sarah. I oversee Region 3, so it's nice to see some of you on the call. Thanks so much for making it to our webinar this morning, to everyone who is here with us today. And I'm just going to go over some of the VHSP guidelines and changes and updates that we've made to those. So that's the fun part, right? We get to get into the nitty gritty a little bit. Just as, yes, people constantly ask me to foot the bill. Thank you, Elena. I'm not sure it was relevant to homeless services, but I will definitely be making use of that pun. So thank you. Yeah, just as an overview, the Virginia Homeless Solutions Program, otherwise known as VHSP, supports the emergency crisis response system, which is what Will was just going through, which is a housing-focused approach to ensure homelessness is rare, brief, and one-time through coordinated community-based activities. Don't try to say that 5 times fast, but it essentially encapsulates everything we just went over. Our goals for VHSP are to assist households that are experiencing homelessness or are at risk of experiencing homelessness to quickly regain stability in permanent housing and to prevent households from becoming homeless again or for more households to become homeless. Next slide, please, Kendall. So this is kind of how our funding is broken down. And I do need to introduce a caveat here. Our actual funding levels haven't been determined as of this presentation. The individual amounts could vary significantly from what is actually being shown on the screen. We're still waiting on confirmation from that. However, this is our estimated funding breakdown. For the Emergency Solutions Grant, the ESG, we got let me make sure. Yes. $2,885,391, a good round number that's easy to remember. The homeless general funds for homeless assistance, we've got about $8 million, $8,500,000. Oh, I'm sorry. Where are you trying to? I thought I heard somebody make a peep. No? Okay. Sorry. 8,656,397, which includes $1.1 million for rapid rehousing, 100,000 of which is specifically for veteran rapid rehousing. And then we've got state general funds for homeless prevention, and that is around, it's almost $4 million, but it's not quite. It is, about $4,050,000. But again, these are approximate levels. Why? This is interesting. That's not what my notes say. I'm so sorry. Yes. So anyway, almost $4 million, and then for a total of $15,075,392. Leading into our match requirements, we do require a 25% match based on the total amount of funding within that's being allocated within your COC or LPG. This is only for your VHSP funding. It doesn't apply to your other grants. And there are different ways to reach this match. You can reach it through cash, through the fair rental value of any donated material or space, and any salary paid from local or private sources, which have not otherwise been charged to VHSP. And you can also hit your match by going through in-kind donations and or volunteer labor. The worth of these in-kind donations and labor are based on the value at the time of the donation or the service rendered. And we can get into more of that if you have questions about what the rendering of services would possibly look like. It's also on page 18 of the new HSNH guidelines for the full listing of match requirements. Eligible VHSP grantees. Who are you? What do you do? These include nonprofit organizations, units of local government, housing authorities, and planning district commissions. And grantees are funded as a result of community-based applications. The application identifies specific organizations that will carry out homeless service activities. And then we contract directly with these individuals or grantees. But there are different ways to do so, which we will cover on the next slide. grantee designations. We've got service providers, service coordinators, and fiscal agents. 3 different ways to be a grantee, essentially. The service providers are individual organizations that are identified in the VHSP Year 1 request. These are organizations that provide eligible activities. It would include like an HMIS administrator, if applicable. Service coordinators may collaborate to provide specific services. We would contract with the service coordinator, and it's the application for the whole entire situation must clearly explain how the service providers are going to work together. So you have to outline that collaboration up front. And then fiscal agents are the third one. This organization doesn't provide any services directly that are covered by the DHCD contract. However, all remittances, documentation requirements, and other program responsibilities have to be maintained by the fiscal agent. We have some agreements like that now. So if that's you, you know what we're saying. And if you have questions, we can definitely answer. Next slide, please. Yeah, we've got some new grantee requirements that we would like to build out more in this application, this cycle of funding. The first is harm reduction. All of our programs that we're about to fund must emphasize a harm reduction approach. No requirement of treatment or sobriety, and termination of assistance must not be based on use of substances. And harm reduction efforts should include approaches to assist the person or reduce or minimize the risk of these behaviors. The second one would be trauma-informed care. All programs have to incorporate policies and procedures into their program design and delivery of services that take a trauma-informed approach. We also are looking for case management best practices. All programs have to ensure case management and supportive services staff have adequate training on case management best practices, including housing-focused case management, motivational interviewing, and the harm reduction approach, as we previously said. And that's not an exhaustive list. It's just some things that we're looking for. And the last one would be proof of diversion. We have updated language on what diversion actually is and how it's going to function in your service delivery. And we would like to see it documented to a greater extent. Next slide, please. VHSP eligible activities. These should be pretty familiar if you have already been remitting for VHSP grants. If you're a current grantee or a past grantee, you will see that these are kind of your expenditure buckets, but not talking just in terms of remittances. VHSP activities and associated costs are intentionally focused on the implementation of the emergency crisis response system. Whenever possible, households experiencing a housing crisis should be diverted from entering the homeless services system through problem-solving conversations, linkages to mainstream and natural supports, and light-touch financial assistance through flexible funding sources. If, however, they actually enter the homeless system, I saw a question about diversion. We will get to that. There is more resource sharing to be done on diversion. Do not worry. We're not just going to leave you to the wolves. So we're just going to kind of get into the new updates on each of these sections to that end of trying to provide funding across all those different categories. So the first one would be outreach. This is for oversight and supervision of direct services staff. And this has always been eligible, but it had not been like explicitly outlined in the guidelines. We added language just to incorporate, clarity about outreach providing this sort of like program guidance. You'll also see language that has been added to prevention, emergency shelter operations, and rapid rehousing that will kind of add on to these additional requirements. And yeah, just to clarify, the oversight and supervision of engagement and housing-focused case management staff was always eligible under outreach. We just wanted to make it a little bit more clear. We also added that funds can be used to transport households to a permanent destination, such as reuniting with family or friends in another locality. You'll see that come up again as well. Let's see. Coordinated entry. So we have consolidated rent and utilities into service location costs. This has cost a little bit of confusion so far on on some people's ends. We will have some more guidance regarding how those things now come together. We're also, per the question, defining diversion and its practices within the CES delivery. So that's going to come up again as well. Prevention, if you would. Yeah, this one's kind of the big one. And I'll try to spend just a little more time on it, but I know we've got a lot to cover, so we're probably going to fly through it regardless. If you have more questions at the end, please definitely ask them. We've removed a couple of things and we've also added some things in. So we're going to just go one by one. We removed the homeless certification form. Now there's a prevention project participant form, and it has been updated to collect necessary eligibility documentation. So we don't have to have, you know, two separate forms or still the homeless certification form. We also removed, excitingly, the $500 asset limit at initial and recertification eligibility. Now we've opened it up a little bit so that in order to be prevention eligible, besides meeting all the other requirements, the language in place is the program participant lacks sufficient resources and support networks necessary to retain housing without prevention assistance. This is a change from before when we were using that asset limit actively. So we're just trying to widen the opportunity to assist by using prevention funding here. We also adjusted it to match the ESG requirements. If VHSP prevention funds are used for rental assistance, the unit has to meet both FMR and rent reasonableness. The way this was previously written in the guidelines caused a bit of confusion over whether the units had to be eligible if a grantee was paying rent arrears only. So we're hoping to clarify this. It now matches that ESG language. We broke out of the required documentation as well for clients that are receiving VHSP prevention rent assistance. This is another change that you're going to see more than once. We are no longer using area median income as a benchmark or like something to compare to. We're now using median family income. This is to be in compliance with HUD. Do we need to pause here? I'm noticing a couple.
I'm sorry, Sarah. Because you're going fast. Can you just go back over the clarifying language section again about the FMR and rent reasonable? I think I missed something, like when that's being done.
Sarah, can I help you here? Just Erica,
sure.
For clarifying language. So it's if you are using VHSP prevention funding to pay for someone's rental assistance, you still need to verify that it meets FMR and rent reasonableness. If you are only using these funds to pay for someone's rent arrears, utility assistance, et cetera, and do not need the rental assistance, you do not need to touch FMR rent reasonableness.
Thank you, Kendall. That was a very good clarification, very succinct way to address that question. And Erica, that was a good one. So thank you for raising it. Yeah, kind of diving back into MFI versus AMI, you're just going to see that every time it said AMI in our guidelines previously, now it's going to say MFI for median family income. And this is to bring us into alignment with how HUD is discussing these income requirements. So they're now using MFI as well. We have now added client file required documentation. We need evidence of coordination with mainstream resources. And this can be documented several different ways. We remove the words as appropriate because it's something that we really would like to see across the board. It's now kind of requirement. It's now a requirement for monitoring. Like we're going to be looking to see that coordination with mainstream resources is happening across the board, not just as appropriate. We also added see that oversight and supervision of housing focused case management staff. This is an eligible expense under housing focused case management. This was just to clarify that language once again. So now oversight and supervision of the case management staff, which was already in place as an eligible expense, is just, written out that way. So yeah, next slide, please. Okay. Emergency shelter operations. we added the language stating that grantees must not implement a maximum length of shelter stay. Kind of like Nichelle said at the top of the hour, our stays are up. What was it? 143%. Yeah. So we're understanding that you all are working your hardest and using all the resources that you have available to be able to move folks out of shelter into rapid rehousing, out of rapid rehousing into permanent housing. We understand that this is still happening to the greatest extent possible, but we don't want you to be freaking out over the maximum length of shelter. We're not looking at it like, oh, those folks have been in shelter longer than 90 days. Like, we don't want to fund you anymore. We want the transition to work as well as it can between the grantees going from one program to the next. So hopefully that provides a bit of ease. We also added, this is, you're going to see a lot of these things come up again and again. Funds now may be used to transport households to a permanent housing destination, such as reuniting with family or friends in another locality, and oversight and supervision of housing-focused case management staff is now an eligible expense under housing-focused case management, much like you saw before. All right, we are in the thick of rapid rehousing. Okay, once again, we removed the homeless certification form, so that's not due at the time of intake or at recertification time. We removed that $500 asset limit at recertification eligibility. Once again, that language just states instead that there are no other resources and that the family or the household would need to be assisted using these funds. We added risk mitigation funds to VHSP. This is only for state rapid rehousing, and we can provide more detail on that after the webinar as well if you have questions about that. But risk mitigation funds, and we're going to get into those a little bit more in just a second, are basically to be able to establish and maintain relationships with landlords, to keep working with them as you're trying to transition folks into permanent housing. And we just made a slight clarification on here in the veteran rapid rehousing assistance. We the previous language had indicated, I believe, that it was a veteran or their spouse or like the head of household. And this rewrite just clarifies that we're looking at the whole household, not just based on their spouse or like legally married people. It's to assist the household that includes a veteran. So hopefully that opens it up a little bit more. More indeed on the rapid rehousing. Y'all are going to get so tired of my voice. Let's see. Once again, we changed our language. Every time it says area median income in the previous guidelines, now it says median family income. We also added coordination with mainstream resources, like we were talking about before. It was only emergency shelter and outreach before. Now it's just across the board. We would like to see coordination with mainstream resources for each of these programs. Oversight and supervision of housing-focused case management staff. That is also an eligible expense under this one. And we adjusted the service location costs as only being eligible under state rapid rehousing. ESG is noting that this has to be billed to administration. It's an admin only expense. So those service location costs are not eligible under federal, if I'm not mistaken. Kendall. Okay, thank you. I also realized that I totally did not talk about the risk mitigation funds as soon as I mentioned it. So I'm really sorry. Want to take just a second to go over that. Remember when I was like, oh, risk mitigation funds, that is to establish and maintain relationships with landlords. Yes, and we have more guidance on that. This is going to be also eligible only under state rapid rehousing. We cannot necessarily bill it to federal rapid rehousing. The activity seeks to improve outreach and engagement efforts between grantees, the households they serve, and landlords or property owners. And we can, obviously provide more guidance around this too, but some of the eligible landlord incentive costs, which are what we're calling risk mitigation, landlord incentives, risk mitigation, they are the same. The cost to repair damages incurred by a client that is not covered by the security deposit, that would be an eligible expense through this activity. And let's see, up to 2 months rent or until the vacancy is filled, whichever comes first, in a situation where a client has left before the end of a lease. Both of those eligible expense types are offered kind of as a last resort to maintain those landlord relationships and to encourage any continued reduction of rental barriers. We know that establishing and maintaining relationships with landlords is super important. It's very key in your work, but we don't want that to be like kind of the first line of defense. This is sort of like if you've exhausted all your other options, you can do a Hail Mary and you're like, hey, we're going to pay for 2 months of rent or until a vacancy is filled, if that means you're going to house, you know, another one of our clients down the line. This is important. Any payment of a risk mitigation fund toward a landlord has to be counted toward your 24-month limit of assistance provided to that household. So just bearing that in mind, that's why I said it's kind of the last resort. Okay, great. Now we can move on. Sorry, I just wanted to make sure that I didn't leave that hanging. The VHSP eligible activities update for indirect categories. This is just, it's to offer a bit more flexibility. The COC and LPG planning, we just increased the limit to 10% of one's budget. So it was previously at 7 and now it's at 10. So do with that what you will. We're excited to see where you go with it. Oh, you're welcome, Fredericksburg. And HMIS, no changes to that. Don't worry about it. Administration increased the cap to 5 from 3%. So what are you going to do? Oh, the places you'll go with that admin increase? I don't know. We're excited to see. The revised guidance also means that, oh, you're welcome. We're glad it helps. That the eligible costs include office supplies. They always did. We just wanted to make sure that that was clarified. So in case you need to be buying your printers and your printer ink and things through admin, yeah, knock yourselves out. Okay, FMR waiver. We were talking about FMR waivers FMR and rent reasonableness earlier. Now, just to throw a wrench in the whole thing, this is something that we just sent out guidance about. We have put in place an FMR waiver. It is waiving the FMR requirement for all assisted units. All of the other unit eligibility requirements, including rent reasonableness, still apply if you have this waiver in place. This is only for state funding. You may not use this for anything that is federally funded. So if you're using your federal rapid, sorry, this is probably not going to come into play. Very handy for you. And this is just to kind of break down which programs you can actually utilize the FMR waiver with. For VHSP prevention, for VHSP state rapid rehousing, not federal, and for the Housing Trust Fund, all project types. We hope this provides a little bit more flexibility. A lot of you have talked about how FMR has been a barrier for being able to place households in permanent housing. So we just wanted to implement this while we could. So here you go, FMR waivers. And we will answer more questions about that at the end. Can we go to the next slide? Thank you. All right, so we've got 2 slides on key outputs and performance measures. I told y'all you were going to get tired of my voice because I'm not done talking to you yet. We are going to require that you report out on the following outputs based on HUD system performance measures. One of these is, oh, you're welcome. So we've got demographics, permanent housing placements, so destinations, the length of time a household receives financial assistance, that's for targeted prevention and rapid rehousing, the length of time receiving case management for prevention and rapid rehousing, capacity and utilization for emergency shelter operations, and prior living situations. Some of these are probably familiar because you just did those mid-year reports. If you're brand new to the whole thing, you don't know what we're talking about yet, but that's okay. This is what you're going to be measured on. Let's see. And let's go to the next one, if you don't mind, Kendall. All right. During agency and system monitoring, evaluations of the following processes will also occur. So this is not just reporting out. This is how we would actually monitor and track your progress. Ensuring that all households, and this is for the COC, right? At the COC and LPG, level, we want to make sure that your coordinated entry system is working appropriately. So we're going to be ensuring that all households at the entry point are assessed with a standardized assessment tool, and that the entry points are low barrier and easily accessible for all folks entering the homeless services system, and those diverted away from it. The service providers must refer appropriate households seeking shelter to the entry points. There needs to be appropriate written policies and procedures that are implemented, and we, DHCD, have to review and approve these and all the revisions that you make to the written policies and procedures across your COC and LPG. And individualized housing-focused case management must be provided to each household in order to ensure they're going to the right spots. Woo! All right, next slide, please. That wraps it for VHSP. We're going to talk about HOPWA. And I must put out the disclaimer that I am not the person to talk to about HOPWA. I am just providing some information for you. But my esteemed colleague, Darrell Wilburn, is the HOPWA contact. He is the HOPWA extraordinaire guy. So if you want to, Darrell, if you're on and you want to drop your email too. No? Oh, you're not? Dang. Okay, well, if somebody wants to drop Darrell's email, that would be great. But he is the HOPWA guy. HOPWA is, thank you, Kendall. HOPWA is housing opportunities for people with AIDS. And the goals of HOPWA are to assist eligible households to maintain their housing stability. These funds will be focused on direct housing assistance and supportive services to those who are most in need. The activities of primary importance are basically to make sure that the services that provide housing assistance and services that assist this population to maintain housing stability are able to help them maintain complex medication regimens and address HIV and AIDS related problems. So this is really where that medical and housing, those worlds intersect in a beautiful relationship. As far as HOPWA grantee requirements, we've got no changes made to the HOPWA guidelines from the previous grant cycle for the 2022 to 2024 cycle for HOPWA. It's not any different from what we had in place before. But just to go over them real quick, in case you need a refresher, we've got financial training, HOPWA housing quality standards, and confidentiality, all of which are requirements to be able to be a HOPWA administrator. And you must see page 43 for a whole list of all the HSNH guidelines for HOPWA. Next, please. Here are the eligible activities that we just talked about. Tenant-based rental assistance, TBRA. We've got short-term rental, mortgage, and utility assistance, STRIMU, the easiest one to say. Supportive services, including permanent housing placement. We've got housing information services and administrative costs. All of those are eligible under our HOPWA grant. And I believe that this involves me just passing the torch to Kendall Clater. And I don't have a joke for you, but Kendall, please take it away.
Thank you very much, Sarah. And I did not get tired of hearing your voice. Thank you for all that information. I do want to pause and just make sure everyone's aware that, please do keep dropping your questions in the chat. We're going to take a lot of time here at the end to answer all the questions. And for anyone that's dialed in, we'll read out those questions as well. And we'll also welcome anyone to come off of mute and have some open conversation. All right, so the Housing Trust Fund Homeless Reduction Grant Bonus, this is something that our team is honestly very excited about building into this application. You've heard us say year after year that this is pretty much level funding that we're expecting, and so we're not able to make really great changes to the funding level to be expected in your community. Adding in the Housing Trust Fund bonus will make it so that we're able to recognize the communities that have additional need and are making great strides in their performance to serve persons at risk of or experiencing homelessness to increase our support of those communities. So this bonus was made, this decision to include it as a bonus was made as a result of our HSNH input sessions from 2021. So we built a portion of the Virginia Housing Trust Fund into the HSNH 2022-2024 community application. Communities are invited to submit requests for funding to support rapid rehousing and permanent supportive housing for persons who are chronically homeless. And in the next section of this presentation, we're going to go into detail on what information must be included with these requests and how DHCD will award the bonus funding. I did also want to note here that underserved populations innovation projects will remain a separate application. And those applications, or the application opportunity, will be released in late summer. All right, so now we're going to move into the application details section, which will review how to access and complete the application, how DHD will make the awards decisions. So here's some just primary information. In the next couple of slides, we're going to go to actually how to work through CAMS. But CAMS is our centralized application management system. It's our online application management system. So everyone that's applying must have an organizational profile. It does take a process for requesting and being approved. So please do, if you are a new lead agency or a new applicant, please do leave some time to have that organizational profile created. There's one application accepted per COC, a local planning group, and it must be submitted by the lead agency. So we've got 27 COCs and local planning groups, so we'll have 27 applications. The deadline for submission is right before midnight on April 4th, 2022. We're hoping that that's going to be some more lead time for you all to have the transparent application process internally at the COC LPG level and create the application for us. It'll also provide time for you all to submit any applications to our team for response before the application is due. So we are providing technical assistance Monday through Friday, 7:30 a.m. to 4:00 p.m. And please do refer all of your questions to myself. And here's the email address in the slides. If you reach out to anyone else in the team or in the unit, they'll just go ahead and forward your response to me, because we are just making sure that we track all the questions. So here are the step-by-step directions on accessing application instructions and guidelines. Again, all of this slide deck and the recording that we're doing right now, they're all going to be released to the grantees and applicants. So it'll be on our website. It's also going to be available in CAMS, and then we'll email them out. So everyone has access to all of these. You don't need to really mad dash write everything out. But you'll be, to access CAMS in general, you'll go to the DHC website. Here's a link here, and click on the Access CAMS button on the upper right-hand corner. You log into CAMS and make sure that you do have that organizational profile created. Click Apply from the top menu, and this takes you to the Apply for Funding page. And then you'll select this grant application, which is Homeless and Special Needs Housing 2022 to 2024 from the drop-down menu, and you'll click Let Go. Right once you click go, you'll be taken to a page that offers a link to the HSNH application instructions and our guidelines. Along with that, you'll also see this slide deck here if you need to reference it. To access the application, you'll go to the Apply for Funding and click Apply, and then enter your project name. And we're asking that everyone uses a uniform process for naming their application. So here's an example here in Oliver. I know you're on here, so you can copy this immediately, but you'll just do Prince William Area, COC, HSNH 2022, 2024. So your COC name, and then the application. And that just helps make sure that we're tracking everyone well enough, and that when we download them for review, it's pretty simple for our team. So once you enter your project name here, it starts your application, and then you'll be able to access your saved application from this last application status from the top menu, and your saved application will be listed under incomplete applications. It'll move to the completed applications as soon as you save the full application and hit submit. I also want to note here that once you do hit the submit button, it's not something that we can send back to you if any edits are made. It's all final. All right, in the application sections, we have 3 different components of the application. The first section is community analysis and processes. This is going to be questions 1 through 15. They're all community-based questions to detail the need in the community and how the crisis response system operates. Part 2 is for the proposed grantees for VHSP and HOPWA. This is 7 questions to detail the proposed grantees put forth for VHSP and HOPWA funds. And the final question, part 3, is providing space for the COCs and LPGs to submit requests for the Housing Trust Fund Homeless Structure Grant bonus. And again, just to clarify, that is for Rapid Housing and PSH for chronically homeless only. It does not include funding for the Underserved Populations Innovation Project, which is going to be a separate application process in late summer. Here's some budget guidance on completing your base request, and then how to also allocate funds in your request to the supportive services or the indirect cost categories. So the base request is a total from the outreach, emergency shelter operations, rapid housing, prevention, and centralized or coordinated assessment entry. When completing the budget for VHSP application, calculate the base amount of the request. So these are all of those categories. and then calculate the COC planning, HMIS, and admin on top of that request. So if your total base request is 100,000, here is an example of how you would then calculate the COC planning. COC LPG planning, it should say. It's not just restricted to COCs, it's also open and balanced state local planning groups, HMIS and admin, and then you come up with the total VHSP request. All right, so narrative guidance. Some quick tips here is that each narrative section in CAMS is restricted to up to 6,000 characters. After 55 minutes of inactivity in CAMS, the user will be logged out. So save your work frequently if it's something that you're just coming to throughout the day or taking some more time or working another document. Read the HSNH guidelines and application instructions prior to working on the application, and then save your narrative of questions or answers in a document prior to cutting and pasting into CAMS. And when you paste into CAMS, paste without formatting. Any type of formatting like a bulleted list shows up very strange in the application. And please do review your entire application prior to submitting in CAMS, because again, once you hit submit, it is final and we can't send it back to you for edits. All right, so some more kind of targeted narrative guidance. Don't assume that we know anything about your community, including how the crisis response system operates, the flow of coordinated entry, or the capacity and approach of any of your proposed grantees. Write this as you would anyone that has never worked with the community before, and you're just explaining simply how the system operates, etc. Utilize data from HMIS and the PIT to tell us what's going on in your community, the need, any gaps, and how the system is functioning. And if there comes a point in the application where the point that you're trying to make could be enriched by the using qualitative data, please do so. Don't rely solely on qualitative data, but do use that to round out your answer. Make sure that all the components of a question are addressed in the response. For example, in question 8, you're going to see that we have a question with multiple points. It's asking whether homeless assistance services are available to the entire community, and specifically break out several populations to access. One of the access concerns is households with limited or no personal phones, for example, and here we just really want to know whether your system offers walk-in access points for coordinated entry, and how or whether your COC local planning group is advertising these coordinated entry access points. So again, that question in particular has multiple points. Make sure that you're responding to each of the special populations that we're breaking out in the question, because it will impact your score if you do not respond to any of the access concerns. Another tip here is to ensure the application process is open and transparent, and include the process for grievance and resolution. We want to know how your community selected the grantees being put forth for funds, and whether new partners were considered. And then finally, provide real examples of community coordination and implementation of best practices. And for example, here in the proposed grantee section, we ask for detail on how each of the proposed grantees implement a housing first approach. So go into detail. Don't just say that they are a housing first organization. Detail the policies and practices that they have in place that show that housing is something that everyone is engaged in initially, and how services are wrapped around once placed in housing. Not that employment or income are requirements prior to receiving a wrapper housing referral, for example. So next narrative guidance is on the racial equity question. On question 12, we ask, how's your COC LPG examined its programs and systems for racial disparities? What was the result of that examination? And what is the COC LPG doing with this information? Have any actions been taken to address the disparities if applicable? So here we want to make sure that everyone is aware that Collective Insight is a consulting group that we have been working with on racial equity work within HSNH, and their technical assistance is available. So if you all are stuck on the examination process, if you are stuck on determining the next steps or anywhere in the process, Collective Insight is available to work through your issues directly with the COC local planning group or any individual grantees. So to access this technical assistance, it's again, it's made free to all of our grantees. To access that technical assistance, please contact your housing program admin with details of the TA need, and also the number of hours that you are likely proposing to access with Collective Insight, and then we'll connect you with the Collective Insight team. All right, so here's how the Housing Trust Fund Homeless Reduction Grant bonus is going to work. We are going to be, this funding is going to be awarded to eligible rapid housing and TSH projects as a bonus based on this application for funding. Each and every COC and local planning group has the opportunity to put forth projects for this funding within their HSNH application in CAMS. There is no cap on the number of projects that the COC or local planning group may propose, nor is there a cap on the total amount of funding that can be requested. Anyone who applied to Housing Trust Fund in years past, you would have seen a $100,000 funding cap. We removed that in this most recent, I guess, maybe 2 application cycles ago. We want to make sure that everyone knows that it's not limited to $100,000, that you can request what is needed to support the project. To submit projects for this bonus within the application narrative, in CAMS, there's a space to detail each eligible proposed project using the following format. We're going to be asking for the organization name, project type, so you'll state Rapid Housing or PSH, funding request, which is just the total amount of funding for that project, total number of households to be served, and a brief description of the proposed project, including the proposed activities. So following the application review process within HSNH, we will consider this request for Housing Trust Fund put forth within the application, and we'll select proposed projects based on the community need for funding and the community performance and outcomes. If more information is needed from the proposed grantee organization, our team will reach out for more information. And it's also exciting to note that we anticipate having the final amount available to the Housing Trust Fund Homeless Reduction Grant by April. So that's going to be before our negotiation calls for this application. So we'll aim to have the details on the proposed projects for it by that time, and our team will put forth for the Housing Trust Fund during negotiations to aid in community planning. All that means to say, if we are expecting that we're going to be awarding $500,000 in Housing Trust Fund to your COC, it'll help us decide then if we need to move any of the VHSP funding around to other different eligible activities. For the Housing Trust Fund bonus projects that are going to be awarded, again, we're going to be hopefully confirming all of that information during the negotiation across the community so you know what's coming. And then we will be submitting the proposals for full approval, and the grant projects will begin January 1st, 2023. All right, so here's a list of all the application attachments. The only note is for the year 1 request that this includes all proposed VHSP and HOPWA grantees, do not include sub-grantees. So if you have anyone who's acting as a fiscal agent or service coordinator, only include the grantee who we are going to be having a direct grant relationship with, a direct grant contract with, and then any MOUs we're going to be having submitted separately. So when completing this form, do not enter any formulas in the spreadsheet either, and always use whole numbers. All right, so here is some of the scoring criteria, or all of the scoring criteria. It's important to note that applications must score 60 points out of a possible 100 to be considered for funding. However, DHCD does reserve the right to fund COCs and local planning groups scoring below the 60-point threshold to ensure statewide access to VHSP. For community need and performance outcomes, this section is completed by DHCD and includes the following components. We look at for need, we look at fiscal distress and prevalence of homelessness in the community, and we also look at the PIT data. And for community outcomes, we use the following HUD performance standards. First, it's exits permanent housing. Second is change in returns to homelessness. And third is change in first-time homeless. In years past, we also evaluated change in length of homeless and cost per household. However, due to the pandemic, we determined these would not be helpful measures, and so we are not scoring based on those. All right, so for negotiations, we have tentatively scheduled these for May. So we'll be doing the full application review process through to probably mid-May, and then the rest of May is going to be scheduled in calls with COCs and local planning groups to talk about the proposed funding, any of the recommendations that we have on how funding is allocated within the community. We'll discuss the proposed activities, proposed grantees, clarify any information that we need to that was presented in the application. And then we'll also, as stated previously, we're going to discuss the Housing Trust Fund bonus and confirm the amount that the community should be expecting through Housing Trust Fund. All right, so here is the slide on technical assistance. If you have any issues accessing the grant application in CAMS or working within your organizational profile in CAMS, please contact the CAMS help desk. This is the email address for them. It's just camshelp@dhcd.virginia.gov. They are really great at responding. So just email them and you should have a response within the next business day or so. Any programmatic or application questions should come to me, Kendall Clater, the housing program manager, and my email address and phone number are listed here. You can also contact your housing program admin with any questions, and they'll refer on to me so that we can make sure that we are giving standard guidance across. And then also if anything comes up that needs further clarification that would everyone be benefit from, we'll make sure that that gets sent out. All right, and again, any contact information, these slides are going to be sent out after the call, and also the recording will be made available. So you can always refer back if you have any questions. All right, so with that, I'm going to go back through the chat box, and then anyone that wants to raise their hand or unmute, or if you're dialed in, unmute will also get to you. So anything that's written in the chat, I'll make sure to call it out too, just in case anyone is dialed in. The first question is, will we receive a copy of the slide deck? And yes, you will. Everyone's going to receive a copy of the slide deck. It'll be made available on our website, also in CAMS with the application, and then we'll email out as well. Where can more information on diversion be found? So in our guidelines, we have defined diversion and also built it into each of these sections. So it's shelter and coordinated entry specifically about what we're looking for in diversion, how it operates within the system, and then any additional technical assistance that's needed, please contact your housing program admin. The next question is, could DHD provide us with a documentation list for the evidence of cooperation with mainstream, or I think it's evidence of coordination with mainstream resources to let us know what you're looking for? Absolutely. So if you go into our guidelines, you'll see where this is used. And the ultimate goal of this is to say, just to document that you are working directly with the clients and helping connect with mainstream resources. So if someone is placed in rapid rehousing and through case management, you recognize that they have a need for access to food pantry, that you make that connection with community resource. If they have, if you talk about transportation barriers, that you connect with a available resource in the community to access either, bus assistance or, a vehicle loaner if that's available in your community. It's anything like that. And it could be a checklist. It could also be just notes in the case notes. We do also have guidance available that we issued. Goodness, team, I think we made it available in the fall of 2021. That is for direct service staff to look through their client files and provide any guidance on how to complete the client file documentation. So if you access that resource, which is again available on our website, you can see step by step what we're looking for in the coordination with mainstream resources. All right, lots of people excited about the adjustment in CAPS, so that's good news. Anthony asked, is prevention as a whole can waive FMR? Yes, so FMR waiver is retroactive to July 1 of 2021, and it applies to all of our state funding. So for VHSP, it's all of prevention. And for VHSP, it's state rapid housing only. Remember, we do build in federal ESG into some of the rapid housing, but it's broken out in CAMs. So you'll have a portion of your rapid housing fund with federal and portion with state. It applies to all the state funding. All right, let's see, another question on the application instructions. Make sure that you're looking at the application instructions available in CAMS for the 2022-2024 program year, because it is April 4th, the due date for this application is April 4th, 2022. It also will change, it might actually say that you might be looking at a typo. So if anyone sees a March 20th, 2020 deadline, disregard that. It's April 4th, 2022. That deadline is also reflected in CAMS on the project setup page. And Sarah had dropped in for technical questions to contact us, CAMS Help Desk, contact the CAMS Help Desk email address. All right. Erica asked, this is a good question, Erica, thank you. Can an organization just apply for housing trust and bonus, and do they have to have other DHD funding to apply for the bonus funds? No, absolutely not. If you all have a program or an organization in the community that could benefit from housing trust fund, you may put them forth for that bonus. If we do not have an existing relationship with them, we will reach out for additional organizational documents just so we can do a capacity assessment. Otherwise, please do include anyone in your community that's doing an eligible project. So an eligible rapid housing or PSH project, they are welcome to access the bonus funds. And again, we're going to be working directly with the community to award those to support anyone that's noticing additional need for funding in the community and also has positive performance. And we want to be able to support the efforts being made there. So if there's any new grantees and new organizations that would like to be put forth for the bonus, we will take the suggestions from the application, and then we'll work directly with you all and with that organization to make sure that they are eligible. All right, where can we find this year's documents, the budget, certification forms, and match forms? Those are all linked in CAMS on the application page. If you go to the attachments, the individual attachments are linked there. That includes the year one request, the certification forms, and the match forms. Amanda or anyone else that would like to access those outside of CAMS, we'd be happy to email those as well. What dates are the individual agency applications due? So we do not take individual applications. This is, again, a community-based application. So everyone is going to be coordinated through their COC, local planning group lead agency, to submit the application. As we talked about in the part 1, part 2, part 3. Part 1 is all this community level information. Part 2 is where the lead agency will be responding with the information on the individual grantees, again, submitted through that same application that's due April 4th. And then part 3 is that housing trust fund bonus. So please, all the COCs, local planning groups, will do an application process to determine who's going to be put forth in this application, and it's all going to be put forth in a single application. Let's see, can Kendall repeat the scoring criteria? Yes, we can go back to scoring criteria. So we've got community need and performance outcomes. That's the portion that is going to be predetermined by DHD. We're going to be looking at fiscal distress in the community, prevalence of homelessness, and also the PIT data. We'll also be looking at some of the performance outcomes. And then the next 2 sections are based on the responses in the application. So the first one is that COC, local planning group level approach and coordination. That's the part 1 of the application. And the second is proposed grantee level capacity and approach. That's part 2 of the application. We're really talking about the aspects of the individual proposed grantees for VHSP and HOPWA. All right, another question on how would you like us to document the match requirement? That is done within the proposed match form that the lead agencies submit along with the application, as well as in the lead applicant project for HSNH. Let's see. Jamie asked, can you reshare application naming convention? Let me go back to here. Okay, so it's going to be your COC's name and then the application year. So it'll be for Jamie, it's going to be Fairfax COC HSNH 2022-2024. And this is, again, a suggestion. It's not like we're going to ignore your application if it has a different naming convention. It just makes it easier so we can track everyone's applications. All right, when submitting the application in CAMS, should individual agencies just skip the COCs? Okay, so again, sounds like we need some clarity. There's no individual application in CAMS. There's going to be 27 applications. The COC lead and local planning group lead submits the application on behalf of their community, and will include the proposed grantees information in that part 2. All right, some technical questions. It looks like the HSNH applications link needs to be corrected in CAMS, so we'll do that. All right, proposed match is available, and we'll make sure that that's accurate as well. How is the admin going to be shared with lead agency and provider? So that's a community conversation. The admin level is at the total, is assessed at the total base of the funding request going to the community. So, and within the community, once we determine the funding levels, you all will go back and make sure that everyone has a submitted year 1 request that's reflective of the community need. So you're funding all the eligible activities appropriately and determining how the admin will be broken out across the providers. And then let's see, the last question here is DHD is to review the approved policies and procedures. Is that an agency level or COC level? That is at both levels. So anytime we ask that anytime, and you'll see this also in the guidelines, that we ask that anytime you make a policy, a change to your policies and procedures, that you alert DHCD so we can also review these. Otherwise, it's only going to happen in the monitoring process. All right, so that's all the questions I see in the chat. We got one more. For clarification, is the housing trust application in the process replacing the housing trust application that occurs in October, November? Okay. There's going to be two separate housing trust fund processes. The process we always fund within this application a rapid housing projects, permanent supportive housing for persons who are chronically homeless, and the underserved populations innovation project. For this application, so the HSNH 2022-2024 application, we are building housing trust fund in as a bonus for rapid housing and PSH projects only. So there will be no fall application cycle for rapid housing and PSH. That is all now as part of the homeless special needs housing application that we are going to be having due in April. The underserved populations innovation project is a separate application process, which will be slated to be released in late summer. And I would say that another question is, when does review and approval of policies start? We ask that again, as any policies are adjusted, that you contact your program admin to work with them on that and make sure that they have access to the policies for review. Otherwise, we have a monitoring process internally, and we'll review all policies at that time. We do a standard risk assessment each year for all of our grantee organizations, which determines when the next monitoring will take place. But usually no less frequent, I suppose, than every 3 years for each organization that's granted under VHSP. Yes, another question is confirming that all CHIRP funds are scheduled to end with no plans for renewal. That is correct. The remaining grant funds are all federal, and we have not heard that any of this funding will be coming back or renewed for use for COVID-related needs. So the CHIRP that we have currently available is ESG-CB, which ends in September, and then CDBG, which ends in March.
Kendall, this is Sam. I'm hoping I can ask this in a way that makes sense. So our process for the COC application is that we accept all the applications, they come in, our funding and performance committee actually reviews them, makes a determination whether or not they'll be included, and that actually ends up ranking all of our projects. We submit the request of all of those that are accepted, and then once we get the allocation for our community from DHCD, we go through our ranking list and fund until we run out of money. Now, what has happened in the past is that some of the ones who end up below that allocation level from DHCD are, let's say, rapid rehousing projects. So my question in regards to this application has to do with Housing Trust Fund. If there are projects that are potentially falling below the funding rate for VHSP, should those be included for a potential for Housing Trust Fund bonus on top of the ones that we would have originally submitted for Housing Trust Fund to allow for other options for those projects to be submitted even though they couldn't be funded through VHSP? Does that make sense?
Sam, that makes sense, and I'm really glad you asked that question. And Michelle, I'm going to look to you because of, for the historical knowledge. We have never seen, at least in my recent history, we've never seen a significant change to VHSP funding. So let's just take the assumption that this year is going to be the same, and the state is not going to give us additional dollars, and we're not going to get additional dollars through ESG. If that's the case, then you can expect not to see major adjustments in the level of VHSP funding that's coming to you. I mean, every year we do make some adjustments. We try to right size our funding as much as possible, but ultimately our goal is to fund across the Commonwealth and make sure that all 27 COCs and local planning group have as much VHSP funding as we can get them. So let's just assume that Fredericksburg or any other COC is not going to be seeing a major change in VHSP. If that's the case, then yes, please do put forth any other projects under Housing Trust Fund. Right now, we don't know what's going to happen with Housing Trust Fund. In the governor's budget that was put forth, there was a significant increase to Housing Trust Fund. It's of course going through the to the legislature right now. So we don't know what's going to happen, but by the negotiation calls in May, we will. So go ahead and put all the applications or all the proposed projects that any local planning group and any COC could see use for in that housing trust fund component of the application. Once we then are able to go through negotiations and we start looking at the need in this continuum of care or the local planning group and the performance, we're going to then go through and award those projects based on what we're seeing in the community and making sure that we're able to increase our funding to you all as much as possible and as much as needed. So yes, Sam, that all makes sense. And if that's your community process, you can still include it under VHSP, but it's likely that you're not going to see a big increase. You still would not be able to fund those projects. Nichelle, am I dancing around?
You are 100% on target. And all I wanted to add, because Kendall put this really well, I think many of you have inquired about, like, how come we're never able to get any more funding? And you always hear the same thing, at least for the last 10 plus years. It's been pretty level, maybe a difference of up to 10% either way, but never more than that. And I can say in the 15 years I went back, those numbers are the same. We're 15 years later from when I started, and our numbers are really close to the same as what they were in 2007. With that being said, the argument has always come up, why are we even applying for funding? Why can't it just be a formula? Because it's not going to change. Can't be a formula. It has to be some sort of competitive process. So what we did, and Kendall and her team really thought through, what's the best way to help reward or give grantees more funding. And so that's why we've shifted some of the Housing Trust Fund to become bonus. We mirrored that off of some of how HUD does the HUD COC application. So that bonus means as you write your application and you do a really good job, you have a stronger chance of getting your Housing Trust Fund, Rapid Rehousing, and PSH projects funded. On the flip side, it means that say you don't give us the information we're saying, say you say things like they're housing first with no other information, it will put you in a lower level where you may not receive bonus funding and those projects won't be funded. That's more of how a competitive application works. And we just haven't had the money to do that. And so it's been nice to be able to kind of repurpose how we do Housing Trust Fund. And also to tell you earlier, because I know we were out the gate pretty early this year telling you, and that still wasn't early enough for you to do your planning. This time you'll be able to know before July 1st that you have more money coming in January to be able to appropriately work with your funding and work with all the grantees in the community. So hopefully that helps, Sam. I mean, the thing is, this is taken out of, I think, years of y'all saying, why are we even doing this if the money doesn't change? And so this is an attempt to address that.
No, that's super helpful. And I think the other question to piggyback on that is the Housing Trust Fund is not included in the year one request form. It's only in that one question through the application, which means the COC cap, admin cap, is only on the VHSP request, not VHSP and Housing Trust Fund.
Correct. Yep. So Housing Trust Fund will still have, it's still pretty separate from the VHSP funding overall. And the year one request, you will only be including VHSP and HOPWA. Again, but that's because that funding runs July 1 through June 30th, whereas the Housing Trust Fund is still in the calendar year.
Okay. And then will there be coordination with COCs as we get closer to a start date? I mean, applying in February, early in 2022 and a start date for Housing Trust Fund of early of 23. A lot of things happen in those 8 months. Is there a coordination with COCs around whatever projects may be selected for bonuses, or what happens if it's still a need, if there's other things that we're looking at, I mean, that's just something I'm throwing out there as a thought. I don't know that I will, let's say, apply for a youth rapid rehousing project, and then all of a sudden this beneficiary comes forward and says, I want to give you all the money for this project, and now that project's no longer needed. But it's just something to think about as things quickly change in 8 months.
I wanted to jump in on this one because think about the HUD COC application and the long amount of time between when you ask for the funding and when you actually get the funding. It could be almost like a year and a half, right? And things have changed in communities in that year and a half. And that's just the way we set it up. We have to, because if not, we're back to that same thing of, we're at December and you need to know, am I going to have this money in January or not? So you are being asked to kind of forecast, but we're hoping your forecast is based on the trends you see in the community and not what you see today, but what you've been seeing over time. And say you do get somebody who gives you all this money for youth, then I would say shift other things around, but you still applied for youth. You could always turn it down and say, hey, you're giving us this grant for youth. We don't want it. Thanks. We don't need it, which is fair to say. I'm sorry, Andy just asked the question about the youth demonstration project. So that's a whole separate conversation from this. But Taylor is gearing up to start working with the different local planning groups and COCs to talk about the youth homelessness demonstration program and how she can help other communities get to a place where they can apply for it as well. But that's not part of this at all. Because the underserved populations application, that's in the late summer, early fall. So this is strictly a rapid rehousing project or a PSH project is what you're applying for as part of the bonus, not those underserved populations ones.
Kendall, this is Rachel Hunley with HCHC Care Management. I have a quick question, a HOPWA, obviously, question for you. I think I'm asking this as a newbie, even though, as I told Kim, I've been here almost 2 years. It's all been under COVID, and so nothing feels normal. We have in our files a sub-grantee agreement that we had to re-sign last fall that is dated for 2021 to 2023. Is that just because you always do it for 2 years? Is that a typo? Is something weird with us because our funding has always been weird up until now, or what?
Yeah, Rachel, HOPWA's always been weird. So everyone with VHSP, ignore this response because it's not going to apply. But for HOPWA, we have a longer funding use period. And because so many HOPWA providers were off schedule, especially because, I don't know if everyone remembers, Rachel, you won't within 2 years, but there was once HOPWA bridge funding that interrupted a grant schedule, and now we have HOPWA CV funding that's interrupting a little bit. So we went ahead and under all of our grant agreements issued them for 2 years. That just allows it so we have fewer amendments that have to be created and that you're able to access that funding for a longer period of time.
Right, so that was for that specific funding in case it took us longer to spend it.
Yep. Yeah, so you'll see that going forward for all HOPWA grant agreements, and unless there comes a time, and hopefully there will, that we're all on track with HOPWA, that you won't see it again. But right now, all of our HOPWA grants are for 2-year periods.
Okay, understood. Thank you.
And I want to jump in, Rachel, to say we used to do it for 1 year, like Kendall was saying, and we actually not got our hands slapped, but HUD kind of said to us, these can go for a longer period. We need you to stretch them out. If you're not seeing people spend it in a year, why are you continuing to do something? Like, why are you doing the same thing over and over again? And so they said we need to extend those out. Again, this is not for everybody, just HOPWA, but please keep in mind that if we ever get to a place where they are being spent in that year, we will probably go back to 1 year contracts. We just, I don't see that happening anytime soon.
Understood.
Not for lack of trying, I just don't see that happening across the board.
We were years behind and we're finally caught up. And so I think that's why I started paying attention, because we were finally caught up, and before I didn't know. So thank you. I appreciate that.
You're welcome. Another question Amanda asked, should newly funded housing trust fund grants plan to apply under the bonus for 2023 renewals? So I will say, if you have an underserved populations innovation project, And it's likely still going to be in that innovation project phase. We're kind of testing out, determining what's happening with the program, and if it's something that we're a project type and it's something that we can further support through consultation, research, all that kind of stuff, to continue to plan to apply for it under the innovation project. It just allows us a lot more flexibility in how the funds are used, and also it provides access to some more additional technical assistance. If it's a project that's going to be in the phase for full, rep housing eligibility or PSH eligibility, do plan to put it forth as a bonus. All right, can any grantee apply through the COC for Housing Trust Fund, or do they need to be an existing grantee? They do not need to be an existing grantee. If anyone comes to the COC to request additional funding as a Housing Trust Fund bonus project, it could be any organization. If they do not already have an existing relationship with DHCD, we will need to go through a longer period of time of completing an organizational assessment to ensure that they have the capacity and the requirements in place that they can take on the state funding. So if we see them put forth, and if that project is funded, we'll take additional time to collect organizational policies, and complete an interview with the organization, and make sure that we have everything in place in order to issue funding to them, just like we would any other grantee. But no, they do not need to be an existing grantee.
And if I could jump in real quick, Kendall. So Jamie, for the organizational assessment, it would be a similar process that we did with Facets when they came on as a CHIRP grantee.
And just to add that too, having new grantees that aren't necessarily part of the COC is an attempt to also open up for equity, because we know how hard it is for smaller agencies or community-based organizations that are in specific communities to even get in the door. And so to keep it closed to brand new orgs has been problematic, and it doesn't give a chance for equity. So this is also an attempt to open up the door for more equitable solutions. All right, since there are no more questions in the chat, I am going to go ahead and bring this to a close. I want to thank everybody. These were amazing questions. As I hope you can see, Kendall has recorded this. So we will have a recording of the session on I don't know if it's the website or on CAMS, but we will have a recording that is available to you if you need to go back. I know somebody asked about the slides as well. Those will be available. I would recommend reviewing the recording if you can, because that way you're not guessing what's on the slides. You're actually hearing what we tell you, so that you would have that information. So again, thank you all so much. Enjoy the rest of your Tuesday, and we will see whoever wants to join for the joke tomorrow. Take care. Thanks, everyone.